Hello, everyone, and thank you for joining us. Dr. Gehani, you may begin.
Good evening, friends and colleagues. My name is Dr. Chad Gehani, and I am the president of the American Dental Association. Thank you for joining us. As part of the ADA's response to the pandemic, the Health Policy Institute has been monitoring COVID-19's economic impact on dentistry. Their robust findings have given us insight and have informed our recovery efforts. Tonight, in addition to updated data drawn from dental practices, HPI adds a new perspective to the conversation. For the first time, you will hear about how COVID-19 has affected consumer attitude about visiting the dentist. This data has never been seen before, and we are excited to share it with you this evening. We also will be updating you on the latest work from your ADA Recovery Task Force and the newest information on government relief programs available to dentists. The ADA is proud to provide information that supports all dentists in this new normal. We will continue to work hard to lead dentistry through the current crisis. Now, I would like to welcome Dr. Kathy O'Loughlin, our Executive Director of the American Dental Association and tonight's moderator. Welcome, Kathy.
Thank you, Dr. Gehani, and thank you all for joining us this evening. This is important information. COVID-19 has had a profound, unprecedented effect on society and the dental care sector. And with so much uncertainty facing us, it's really important to have good information to guide decisions, both at the practice level, at the federal ADA level, and at the state level. And as Dr. Gehani mentioned, tonight you will hear the newest research and data, never before seen, regarding consumer attitudes towards visiting the dentist, as well as the latest data from dental practices on how recovery is going. And by the way, thank you to the thousands of dentists who have been part of the survey panel. Without you and without your help, we would not have been able to gather this incredibly invaluable data. So you will hear tonight also about the latest government relief programs from Mike Graham, available for dentists, as well as emerging issues related to COVID recovery task force work and the work they're focusing on. And thank you to Kirk Norbo for that. We are also going to start with some presentations, and then we will have a panel discussion. Please note that this webinar is being recorded and will be made available in the upcoming days, and all of your most current information can be found at ada.org/virus. I want to repeat that. We're updating that information on a bi-weekly basis, ada.org/virus. Now I'd like to quickly introduce our panel tonight. You will see their faces a little later, but let me tell you a bit about them. First, Marko Vujicic. He has served as the ADA's chief economist for many years, and he's vice president of the ADA's Health Policy Institute. His team has been tracking the impact of COVID on the dental industry from the very beginning. Next is Jon Last. Jon is the president of the Sports and Leisure Research Group. He has conducted high-profile public opinion research in various industries and is a collaborator on the Back to Normal Barometer, tracking consumer attitudes during the COVID-19 pandemic. Next, I'd like to introduce Dr. Kirk Norbo. Kirk is a practicing dentist in Virginia. He serves currently on the ADA Board of Trustees, and he is co-chairing the ADA COVID-19 Recovery Task Force. Incredibly important work. Next, I'd like to introduce Mike Graham. Mike is Senior Vice President of the ADA's Government and Public Affairs Division, where he oversees the ADA's advocacy work, which has been stunningly successful over the last several months. And last but certainly not least, Nipa Thakkar. Nipa is a private practicing dentist, owner in Westchester, Pennsylvania. She has worked in a community clinic, in a Medicaid practice, in a rural fee-for-service practice, in nursing homes, and has served in several leadership roles within organized dentistry at both the local, the state, and the national level. So I'd like to welcome the panelists and begin with Marko. Marko, take it away.
Thank you, Dr. O'Loughlin. As mentioned, my role tonight is to bring the latest data from a very robust sample of dental practices who we've been collaborating with and partnering with to collect data through this pandemic. As Dr. O'Loughlin mentioned, I also want to just echo a big thank you. This is by far the most robust data collection effort, certainly since I've been part of the ADA. But frankly, we have over 4,000 dentists that we've been tracking for months now, since early March. And thanks to all of you that have been part of this panel, we've been able to gather some of the most accurate, robust data that's really helped guide decision making and help the ADA lead through evidence and data through this pandemic. So I want to just briefly summarize what we've learned so far on how the pandemic has been impacting dental practices. The first question we track is your practice open with business as usual in terms of patient volume? Is it open but lower patient volume than usual? Are you closed but only seeing emergency patients, or are you closed and not seeing any patients, which would be the red bars? And you see there in the heart of the pandemic, when we had the initial policies and recommendations to delay elective care, the vast majority of dentists complied with this. We had a significant, I guess, quote unquote, shutdown of the sector. But as you proceed down, which each wave of data, and if you go right to the bottom of this chart, this is our most recent data we collected last week. About 99% of dental practices in the US have reopened. Just to reiterate, the data we're tracking here is in private practices. We've done a separate data collection effort in FQHCs. We've presented that numerous times in a different setting, but tonight we're just highlighting the data from private practices. So again, about 99% of dental practices have reopened. And our data show that among those that have not reopened, that 1%, the majority intend to reopen in the coming months. So the pandemic is not necessarily leading to large-scale exits of dentists. The next thing we track is patient volume. And we ask dental practices, please indicate this week what your patient volume is compared to what is typical in your practice. And as you can see, the green bars are practice patient volume is closer to normal levels. And as you move to left, the blue and the red it's extremely low compared to normal. So as you see here again at the bottom, at the trough of the pandemic, we were down to about 7% of pre-COVID levels in terms of average patient volume in dental practices. But what a resounding and quick recovery. So the latest data show that roughly on average, dental practices are back to 73% of pre-COVID levels in terms of patient volume. And I think more importantly, the last few waves of data here show that it's really starting to level off and stabilize. So that's an important insight here. We're starting to see patient volume level off somewhere, let's say around 3/4 of pre-COVID levels. And John in a sec will show you a little bit what's behind this, but certainly, however deep the trough was back in March and April, the sector has certainly bounced back, in my view, pretty resiliently, and patients are kind of coming back. This varies somewhat by specialty. I won't spend too much time on this, but you do see some specialties busier than others in terms of the patient rebound. By the way, as Dr. O'Loughlin mentioned, ada.org/virus has links to our full reports in HPI. You can look at these data. I'm just giving the high-level findings here, but these data are cut by, for example, DSOs versus solo practices. We have a dashboard on our webpage where you could look at results state by state in a very interactive, user-friendly format. So ada.org/virus is where you can navigate towards all that. Finally, the last core question we ask each week is, are you paying your staff this week? So this is practice owners responding to this question. And green is kind of, yes, I'm paying all my staff fully. And as you see there, I mean, there were furloughs, there were layoffs. Our research has shown the PPP program has had a significant impact to retain staff and avoid layoffs. So as Michael alluded to, it's been a very success story on the part of our advocacy efforts to ensure dentists have access to financial relief through the different programs coming out of packages coming out of Congress. But bottom line is practices are back to about 90% of pre-COVID staffing levels on average. Now, interestingly, research we've done shows that if you're not back to full staffing as a dental practice, the main reason, according to our data, is that the staff are not willing to return. It's not that the practices do not want to hire them back, either because they don't have the patient volume or the finances don't make sense. So there's definitely potentially an emerging issue with difficulty bringing back staff into dental practices. And incidentally, and we'll talk about this more in the panel, our data show that the last type of health worker or last type of member of the dental team being hired back is actually employee dentists. They're only back to about 75% of pre-COVID levels in terms of their employment, whereas in aggregate, staffing is back to 90%. So the data are suggesting that non-owner dentists, these are employees, associates, independent contractors, the data suggests they're the last to be hired back and potentially the ones that have borne the biggest brunt in terms of the employment shock associated with this pandemic. We also track availability of personal protective equipment. So this is practices reporting how much of each of these supplies do you have on hand. And red means I don't have any. And as you move over, green means I have at least 2 weeks worth of supply of these particular items of PPE. So if you just go down to the bottom panel in this chart, this is the most recent data. Thankfully, because of the great work the ADA has been doing, and Mike will talk more about this, there's been significant improvements over the last month, 6 weeks, in terms of the availability of PPE in dental offices. As you see on the bottom, a lot less red than in previous waves and a lot more green. Masks and gowns seem to be the items that are in shortest supply. So we'll talk more about that, but I think there's some good news here about the ADA efforts to kind of ensure that dentists are part of the priority list, and Mike will talk more about that a bit later. If you just go here to the bottom, this is now moving into now some of the questions of the week that we ask. In fact, let's go on the top one as well. So we have kind of one-off questions that we ask once, and we don't repeat them all the time. This is one of those. So The previous data I showed you was the week's supply, the supply in terms of how many days or weeks of each of the PPE items do you have. This question we asked is a little different. We're asking them, how difficult has it been for you to obtain masks, N95, KN95, surgical masks, face shield gowns, and disinfecting supplies? So red is like, it's been very difficult for me to obtain. So remember, these are averages from about 4,000 dental practices across the US. So the red bars are pretty big for N95, KN95s, and gowns. So that's where kind of the main pain points are. And this is an example where we've been using data like this to really guide our efforts and partnerships with FEMA and different types of initiatives to ensure the supply chain loosens up, so to speak, and more supplies flow. On the bottom, we asked those that are having difficulty obtaining PPE, what's the main issue? Is it primarily pricing? So that's the purple bars, i.e. like kind of price gouging, things are overpriced. Or is it primarily that I actually can't find a seller or I can't get enough? That's the teal. And then the yellow is it's a combination of both. So the way we look at this data, it seems to be that it's either both price and the supply, or people are like, okay, it's mainly the supply. So again, from this, we can take away that it's not necessarily that pricing is the problem. It's primarily, look, it's still difficult to get significant supplies of these items. And then in terms of, this is an interesting question we also asked, and we're closed with a couple of these last slides. Definitely we want to monitor what the future in terms of patient scheduling looks like. So we heard from a lot of dentists about, frankly, July being a great month because of rescheduling all the missed appointments from March and April, plus the usual patients that have been scheduled. So it's kind of a very busy month. And that's kind of showing up in our data that patient volume actually has rebounded pretty significantly. We're trying to get at now what the fall looks like. And is there a potential lull as recall schedules kind of get screwed up with the twice-a-year visits? If somebody was scheduled in March and let's say October, November, and now they're seen in July, a lot of plans, for example, don't let you see somebody in July and then again in October. If that's the twice a year, it has to be 6 months in between. Anyway, long story short, we asked dentists to tell us, what is your September and October? What do you expect your volume to be in September and October compared to today? And again, the darker colors to the left are, I expect my patient volume to be higher in September and October compared to today. And as you move to the right towards the lighter colors, you get, well, I expect my patient volume to be lower. So here, our insight is about 1/3 of practices are expecting lower patient volumes in September and October compared to today. And about 1/6, or roughly half that, are expecting higher patient volumes. So there's nothing resounding a lot. At 40% here say, I expect it to be the same. So we're going to monitor this. I don't know if potentially we didn't ask out far enough. Maybe November and December would have been better to ask. But we don't know if there's, quote unquote, this fall lull coming yet, but certainly we'll be the first to know. With that, I'm going to turn it over to Jon. It's been a pleasure working with Jon and his consortium. They are, frankly, the leaders in our view in terms of tracking public sentiment around COVID. And it's been a real great partnership. We've been able to partner and collaborate with Jon and his team to kind of piggyback some dental specific questions on some really interesting public polling they've been doing. So with that, I'm going to turn it over to Jon now to walk us through how the public is thinking about dental care.
Thanks, Marko, and thanks everybody for being here tonight. I am happy to present to you the latest findings from our Back to Normal Barometer, just to give you a little bit more insight into what we actually are doing. Twice a month, we are going out with an extensive survey to a large and representative sample of the U.S. population. We are talking to folks not only through a survey methodology, but we're also conducting a series of in-depth one-on-one interviews with respondents to really gauge their opinions and behaviors, not only about macro level issues that are impacting the country, but about their resilience and willingness to re-engage in a number of different activities. And dentistry is certainly one of them. There's over 16 different verticals that we're looking at, ranging from casino visitation to going to the movies to people's attitudes about schools. And we're going to share with you just tonight a number of macro facts as well as some details, particularly for your sector. And just to kind of give you a greater sense of what we're seeing in this particular slide, this represents the percentage of folks who within the last 12 months engaged in a variety of different activities. So you can see, for example, that 76% visited a retail store and half actually visited a dentist's office within the past year. And we've tracked this across time through all kinds of different activities, all the way down to attending an open house or visiting a home for sale from a real estate perspective. And we'll get into in just a few moments a little bit more about return to the dentist's office. But first, I want to share a little bit about a couple of macro level aspects of the barometer, and that is what we call our confidence barometer. This chart that you see right here basically represents the percentage of people, the 27% number, who feel really good about conditions in the country right now. And that's a pretty low number. To give you some context, my company, many years back after the tragic events of 9/11, did a similar barometer type metric based on a number of the same statements. And the numbers immediately after 9/11 were actually higher than this. What the 27% also represents is, as we've tracked this over time, we've seen this number fluctuate. It actually began in late March, early April at this same level of 27%. It gradually and linearly moved up to about 34% by late May, early June, and then it has kind of meandered its way back downward again. It's kind of been stuck at the 27, 29% level for the last three waves of research, which take us from mid-June through the end of July. This barometer is compiled through 26 different attitudinal statements, both about current conditions and future expectations. Everything from, I feel really good about my personal financial situation, to I'm confident that I'll be able to retire in comfort. And you can see that both the future expectations and current conditions saw a little bit of a decline over the last two waves of the research through the month of July. And driving that downward in particular was a particularly low incidence of folks who felt strongly that the U.S. economy would emerge from recession and begin to grow again at this year. It also showed a similar statistic for those who felt that Americans would be spending significantly on luxuries and items in the year ahead. And the slide you're looking at now actually breaks down the variation in results in this confidence barometer between those states that are COVID heavy versus those that are COVID light. And you can see that the COVID heavy states have particularly weaker confidence than the light states. The way we define that is the top 15 states in terms of case incidence of COVID-19 are the heavy states, and we actually recast that with each wave of the data based on actual CDC data received regarding what situation was within the 3 days prior to the fielding of the research. So certainly those states with a heavier incidence of COVID right now are the ones that are feeling a little bit less confident about how things are going relative to the light states. This next slide's a really interesting one. Looks like a lot of lines. Let me kind of help you walk through this. But this is, as you can see on the right-hand side, are a number of the different vertical activities that we measure, everything from retail stores to flying commercially to visiting theme parks. And it's really a tale of a couple of different trends. When we began in early April, this is the percentage of people who said without any further assurance or hesitation or any further provocation, they were ready to go. They were willing to re-engage in each of these activities. And you can see on the left-hand side, back around April 1, that was not very prevalent. It was pretty much a third or lower. But that began to gradually grow and get a little bit more robust through the end of the month of May. And then what happened, obviously, we began to see social unrest entering into the picture. We began to see a wider swath of states reporting increased incidence of COVID-19, and that was followed by 3 consecutive waves of decline across basically every activity. In this most recent wave, we begin to see a little stabilization and uptick, and hopefully that will continue. But I also want to point out where the arrow is on the right-hand side, because throughout this entire process, there has been a much more bullish attitude about consumers' willingness to re-engage in what they deem to be essential activities. And visiting a dentist office is among them. When we first began tracking this, it was, as it is today, right up there with visiting a retail store, having essential services done within the home, and pretty much almost at parity with visiting a medical office, a doctor's office. And these 4 specific activities you can see have consistently trended significantly higher than other discretionary activities. So as I'll continue to share with you in the next couple of slides, it's really encouraging and consistent with some of the data that Marko just shared from each of your offices, that consumers are indeed bullish about returning to the dentist's office, and it is right up there with the other most essential activities that they look at. So I want to talk a little bit about vaccines. And interestingly, we asked in this last wave whether people would definitely get the COVID-19 vaccine when it's available. You can see that 7 in 10 actually plan to do so, but only 54% strongly agree. And a little bit of context around this, the most recent CDC data about the flu vaccine showed that 37% of folks received the vaccine in 2017-18 flu season. So while certainly this is encouraging to see people willing to do this, I think it's appropriate to realize that there will probably be a discount based on the expressed intent to be vaccinated shown on this particular slide. And with that, another interesting finding that we had, and I'll kind of share with you why I felt it was relevant to speak to you all about it. We actually had one of our subscribers to the barometer ask us to gauge whether people would actually be interested in having the vaccine administered to them through air providers or through hotels. And interestingly enough, over 1 in 4 actually strongly agreed that that would be fine. Another 17%, some would agree. So it kind of poses an interesting scenario. Is there potentially an opportunity for dental offices to also be a delivery mechanism, if you will, for a COVID vaccine? We'll be looking into that with a little bit more specific detail in upcoming waves of the barometer. So let's talk a little bit about what we're finding out specifically within the dental office category. And this particular pie chart explains and shows 4 different segments of consumer attitudes and behavior that we continue to track through the barometer. The 2 green pie slices, as you can see, are the percentage of consumers, and these are among those who've actually visited a dentist's office in the past year. Almost a quarter of them have actually recently reported doing so. And another 57% are ready to go. That's 80% in total who have positive attitudes, need no further assurances to actually return to a dental office. And I can report, again, while we have these pie charts for each of the verticals that we cover, this is among the best results we've seen. Really only retail seems to do consistently higher than anything else. And again, that being kind of an essential activity, food stores, pharmacies, etc., it would be fair to make sense. There are 2 other slices of this pie, though, that are worth looking at. The 8% who are assurance seekers are defined as those who would be willing to resume this activity provided that they have a combination of assurances provided by local or national authorities, and those authorities being defined as either government officials or medical authorities. So that's the next lowest branch of hanging fruit for people that are likely to resume the activity. But there is a 12% minority, and this is a very small percentage. Again, in other sectors, we're seeing this in 30 and 40% plus, who are basically staying put. They are not comfortable resuming any activity absent a medical breakthrough. And we define a medical breakthrough as either a vaccine that's been approved or a proven medical protocol to mitigate and remedy the effects of the virus. So again, this is how it breaks out for dental offices. If we were to show this for other sectors, you would see a much bleaker picture in terms of the distribution of where people fall in terms of their willingness and readiness to re-engage. We also took a look at, among those who needed further assurances, how quickly are they going to come back? And again, from the standpoint of visiting a dental office, you can see that 45%, once they feel assured, they're going to be ready to go back immediately. In fact, 82% will be back within 3 months, and you can see that close to more than 70% would be back within 2 months. So again, relative to other sectors, this is a fairly quick and aggressive rebound. And again, it very much aligns with what Marko shared just a few moments ago from a practice-specific, supply-specific basis. This is from the demand side. People from a future standpoint, once they have that assurance level, they are coming back, and they're coming back quickly. Comment was certainly out there about what would be the impact of an incidence of COVID-19 in a dental office. So we posed a scenario to respondents that, let's assume you became aware of a situation where someone in your area was confirmed to have contracted COVID-19 from a visit to a dental office that you were not personally a patient of. And we asked them which of the following best reflected their willingness to visit their own dentist. And again, you can kind of take a look around the pie chart here and see that generally speaking, with the incident being confined to an office other than the one that they visit, people are not necessarily going to hesitate to go back to their own dentist. You see 15% would be fine without any hesitation or need additional assurances. An additional more than a third, 36% would be fine visiting with assurance from that dental office that they were using the enhanced safety protocols related to COVID-19 in accordance with CDC and ADA guidelines. And an additional quarter would be willing to visit as long as a combination of local or national authorities provided the okay to say that it is safe to do so. Only 24% in this case would not be comfortable visiting their own dentist unless there was a vaccine or a protocol. So the good news here again is that people recognize the very specific local conditions are not necessarily reflective of the practices that are being deployed within their own dentist's offices. And moving from that, we also asked consumers and past patients, which of the following entities would you most trust if they declared it was safe to visit the dentist's office? And the CDC, no surprise, 48% cited the CDC. Certainly they have kind of been the voice of most amplitude when it comes to COVID-related information. But interestingly, almost a quarter, and the next most prevalent response, said the ADA. So certainly your association has a great impact and influence in providing the assurances necessary that dental practices are doing the right protocols to assure safety and sanitization. We found that more than 3 in 5, 60% exactly, had heard from their dentist's office about what they were doing from a health protocol standpoint. 60% said since the pandemic started, they had definitely received information about safety practices from their own dentist. Another 12% were unsure, and just 28% had not heard from their dentist's office. So certainly it sounds like we've been doing a great job. You've been doing a great job of communicating what you're doing to assure a safe return to your practice. And how do they want to be communicated with? We delved into that as well. So we found that people's preferences from a communication standpoint tended to be emails. 56% said that. Obviously, they could indicate more than one response in this particular question. Another 50% comfortable hearing from texts. Another 48% from phone calls. And then a fairly precipitous drop-off in terms of the percentage of folks that would want to hear through a postal service mailing, an online video, or a social media post. So that wraps up some of the more high-level findings that we continue to track within the barometer. We'll look forward to talking a little bit further in the panel discussion part of this, but I want to turn things over now to Dr. Kirk Norbo, the co-chairman of the ADA's COVID-19 Recovery Task Force. Kirk?
Thanks, John. At this time, what I would like to do is just provide you all with a quick update on the task force, where we've been and where we're going. Dr. Gehani appointed this group of 7 members, which included 6 dentists and 1 state executive director, first part of April. And we were charged with serving during his presidential term. And most of all, we were charged with being a nimble group. And I think most of you that have taken a look at the toolkit understand that our statement of the day was professional judgment. We wanted to come up with something that you could customize for your given offices and make it useful to you and your staff. And during this time, we were supported by an amazing staff at the ADA. They've helped us immensely to make this whole thing come together. During this time, we've definitely not sacrificed quality for the speed of our assessments. We've paid much attention to science and made sure that everything we've come up with has been well grounded in science. And we've been able to deliver in a much quicker fashion than is typical of the ADA. So as I said, we had our first task force meeting on April 8th. April 23rd, the Board of Trustees approved our first version of the toolkit. So that was within a 15-day period of time, and I think you all would understand that we were working very quickly to come up with some good information for you all. The most notable resources that we provided at this point are, one, the return to work interim guidance, and two, the hazard assessment and checklist. The return to work interim guidance, or our toolkit, amazingly enough, has been, there's 180,502 submitted forms to obtain this toolkit, which is an amazing number. Of this 180,000 roughly folks, 62% were members, 38% were non-members who have been targeted for recruitment. And of that 38%, we've been able to, at this point, convert 92 to members of the ADA. This toolkit was updated last on July 23rd. A few of the changes we made were, number one, we changed there's a change in the post-appointment patient reporting window of any COVID-19 positive test results to 2 days. It had previously been 14 days, which complements CDC's recommendation. In addition, one of the things I think we've all been maybe not paying as much attention to as in the past is keeping the staff safe as they navigate the staff-only areas of our practices. So I think we've all done a really good job with the staff to patient contact with regard to PPE, but when staff gets together in break rooms or other areas of the office that there's not clinical treatment being provided, there's been issues there as far as maybe dropping our guard a little bit with regard to safety measures and possible exposures if we do have positive situations in our office. Thirdly, we've come up with an additional link to some new materials, which one, I know if you've seen the new flow chart we came up with, deals with protocols to follow if a staff member or household member is COVID positive. So check that out when you get a chance. The other thing that I think is important to all of us who practice is the paying staff who are on leave due to COVID-19. The Families First Coronavirus Relief Act mandates that employers provide 80 hours of time off at full pay, and then up to an additional 10 weeks at two-thirds pay. So that's a big deal for all of us who practice on a daily basis. So check that out. The particulars are in the new update in the toolkit, and I hope it helps you as you navigate any future problems in your offices. The hazard assessment and checklist was last updated on May 26th, and it's been reviewed on a daily basis. Total downloads of that assessment are at almost 15,000 at this point. And this is based upon OSHA's hazard identification and assessment protocol. And as I said, everything is being updated on as often as we need to and add information on a daily basis when we find it necessary. The work accomplished by our task force has included, we've been monitoring information from a number of sources, including CDC, OSHA, and other research bodies. We've also been asking questions of experts and incorporating their information into our responses. And as well, we've been sharing information and materials with regulatory bodies as complementary materials are developed, such as we've been supplying a practitioner's view of how safety and overall health can be continued to be promoted as provision of essential dental health care moves forward. As well as we were responding and providing input to policymakers to assist them as they craft meaningful and practical guidance. And as I mentioned before, we've been blessed to have a really amazing staff involved with this whole process. So currently we've been directing the staff and creating new and updating existing resource materials to help dentists as they move forward in providing care. And so I think most of you probably wonder, okay, what's next for this recovery task force? So the future, I think, revolves around environmental controls. I think many of you have been waiting to hear suggestions, recommendations, guidance in the arena of, let's say, HEPA filtration, airflow, air purification, UV lights, high velocity or extraoral suction, those kind of things that will update your facilities and maybe provide a safer environment for your patients and your staff. So that's, I think, is going to be the focus, and I assume it will be the focus. And there again, we're waiting on science to catch up in some of these areas. So as research unfolds, we hope to be able to provide you some good guidance in a reasonable period of time. Updates of existing materials are as necessary are constantly being provided. And we're monitoring resurgence activities, as we're all aware of, the way this virus kind of pops its ugly head up off and on, and responding as appropriately. The last thing I want to point out, and I think this is a big step, is a week ago Monday, the Board of Trustees approved an interim policy that says dentistry is essential healthcare. And I think everybody on at this meeting will understand that we are not a fringe group. We need to be in the heat of the battle, in the middle of this as medical providers. So this is going to go to the House. This interim policy will go to the House of Delegates in October with the hope of becoming permanent policy. And as we must be able to provide necessary care, which should not be delayed. And I think all of us really, and I've seen some things pop up on the chat here as I've been watching, that we all paid a pretty significant price when we had to close or shut our offices down to routine and preventative care in that 5-6 week period of time from end of March until beginning of May. And it was difficult for all of us, furloughing employees and applying for the PPP loans and those kind of things. It was traumatic for all of us. And I understand where all of you have been. So I think we all understand that we are necessary. Care needs to be delivered. It cannot be delayed. And there's very little evidence of patient to dentist or patient to staff transmission out there in the environment at this point in our offices. Dentistry's had a long history of practicing safely and leading the way in infection control. And as long as I've been practicing, which started in the HIV days, we consistently layer our offices with we upgrade our safety and our infection controls as we need to. And SARS-CoV-2 is no exception to the rule. So we've had fewer patients in our reception areas, increased levels of PPE, our patient screening is more thorough. And all of these are combined to make it a healthier, safer environment for our patients, staff, and dentists. I can assure you we will continue to work hard to provide you with solid guidance and recommendations as we can. And that's where I am with the task force at this point, and I would like at this time to turn it over to Mr. Mike Graham.
Thank you, Dr. Norbo, and good evening, everyone. I just want to point out a few things that Government Affairs has been active on over the last 4 months, and what helped us get through this period of time, I think, better than anything else was the way we as a team at the ADA were able to operate, but also the give and take that we had with our dentists. I know I received hundreds and hundreds of emails and texts and phone calls, and I think that helped us craft the programs that we were pushing before Congress. And probably more than anything else, I would put the Paycheck Protection Program, the PPP loan program, and the EIDL grants and the EIDL loan at the top of the list, because dental practices needed money to get through the first month or so before practices began to open. And that money came in very handy, and Congress actually, which is not easy for them to do, were fairly responsive in our suggestions to make changes to the PPP program, for example, to extend the period that the loan had to be paid back. So a number of changes, and they still plan on making changes in this next package that they're debating right now. In addition to that, when practices were opening up, of course, problem was access to PPE. And we were successful in working with FEMA to acquire 1.5 million KN95 masks that we were able to distribute to dentists around the country. And we're still working with FEMA to see if we can acquire more material to get that into the hands of dentists and dental practitioners until the supply chain comes back. But we were actually nowhere on FEMA's priority list in April, and in early April, and by the end of April, we had moved up to number 4 on the FEMA priority list. Also, and still active, is the provider relief funding. And we've just petitioned HHS. I hope everybody read that. If you haven't gotten your provider relief funding yet or applied for it, you can do that still. We extended the deadline until August 28th. So that's been a huge success for us. And I think HHS realizes that dental practices need that funding. Also, it was mentioned earlier, the Department of Labor has provided small dental practices as small businesses to be exempt from paid leave and Family Medical Leave Act provisions. And I think had they not been exempt from that, it would have been very, very difficult for dental practices to stay afloat. Lastly, I'm glad to see that Congress acknowledged that during this time they needed to suspend federal loans for 6 months. That I know is being talked about with the new package because that 6-month exemption or forbearance actually ends September 30th. And lastly, I want to thank the dentists all around the country because I think this had the greatest impact. That we engaged 150,000 dentists to send nearly 600,000 emails to Capitol Hill during this time. That is a tremendous outpouring of support for what we were asking Congress to do. We absolutely needed that to get Congress to make the changes in the programs that they passed or were about to pass. So, and in fact, folks, we're going to be sending out another grassroots action alert in the next day or so that I hope you respond to. And with that, let me hand it back to Dr. O'Loughlin.
Thanks, Mike. And thanks to everyone on the panel, Marko, John, Dr. Norbo, Mike Graham, and thanks to everyone listening in who submitted questions ahead of time. Due to time constraints, we probably will not be able to answer every question that comes in the chat. We will definitely try to answer all the questions that came in ahead of time. And again, I want to refer you back to ada.org/virus for all of the up-to-date information is available to you to easily download. So with that, I'd like to start the panel. And as you see their pictures come on up, I would very much like to hear from Nipa first. As a newer dentist, we just saw data showing that the vast majority of the public seem comfortable coming back to the dental office, and that patient volume seems to be rebounding very strongly. As someone who's seeing patients all day long, what do you think? Why is the public so comfortable coming back to us?
So that's a great question, Dr. O. And what I will tell you is that I was very afraid that that wouldn't be the case, but I'm finding, just as the data is showing, that patients are becoming quite comfortable coming in. I think that one of the most interesting things that happened in our practice was that right away, as soon as we made the decision to close, we started sending emails and communication to our patients to let them know what was going on. This wasn't a dental problem or a medical problem. This was a human problem. All of us were going through this together, you know, as a race. And so that transparency really communicated to our patients that we care deeply about their well-being. Also, it gave us the opportunity to remind our patients the precautions we take anyway to keep them safe and to make sure that our practices are a place where they can come in and lay back and know that they're receiving quality care. So overall, I think that all of that has had a really major part in why our patients are comfortable coming back to see us, because I think we've reiterated, you know, for them, how careful we are and how deliberate we are in the care that we provide. This has been a very eye-opening experience for sure.
So the trust levels are high. Patients perceive us to be safe and trusted. I guess that's it. I want to ask Marko a couple of questions. You alluded to some potential lulls in patient volume in the fall, and as practices catch up on all of the practices that had to postpone elective care and routine preventive care. As we see COVID cases rising in many parts of the country, I want to ask you a few questions around this. And these questions are for the whole panel. So I'm going to start with Kirk. What does your task force see in terms of a scenario where dentistry could potentially be shut down again for non-urgent care? I mean, give us your perspective on the likelihood of that and what we're doing to prepare for it.
Yeah, I wish I had a crystal ball, but I'd say this to you. There would be in 50 states, 50 governors, you got, a mayor in DC and territories. I mean, they all make the decision. But I would say this, the ADA, with the help of the task force and certainly Mike Graham in DC, has positioned itself well with now this new interim statement that we're going to hopefully get out there and get pushing hard as far as using that for advocacy purposes. That in addition to the fact that little or no evidence is out there that we've had any exposure or problems with the COVID virus in dental offices with regard to the providers and patients. So I think the word is on the street. We've already been back in practice now, I guess almost 3 months, up to speed with routine and preventative care. So I think that information speaks for itself. So I would hope that we don't go down that road again. And I know some of the chat stuff popped up and people on there were saying we can't afford this again. And I totally agree. I mean, it's not necessarily all just from a financial standpoint. A lot of it comes down from the standpoint, I've seen my patients' oral health deteriorate in that quick period of time to where they need some major treatment. So I don't think we'll go down that road again. If we do, it's going to be bad times for all of us.
So the message is dentistry is essential and it's safe.
Correct.
And patient-centered. Great. Mike, there's a lot of questions coming in around the relief fund and when money might be flowing, but if you see a lull in patient volumes and the practices are starting to get concerned, what's the financial prospects for more relief coming our way from Congress?
That's a very good question. And in fact, Congress is debating extending the PPP program in this next package, and the grassroots action alert that we're going to be sending out probably tomorrow to everyone to send to the Capitol Hill is going to ask to allow dentists to have access to more PPP money if they need it. Now, you also mentioned Provider Relief Fund, and that is another opportunity for dentists. And I know there are a lot of rumors about the Provider Relief Fund, and they weren't true. So I encourage dentists to make application for the Provider Relief Fund through the HHS portal, and don't delay. I know they've extended it until August 28th, and I think HHS was very generous in doing that. They heard us loud and clear, but you'll need to get some paperwork together to finalize that, and so get right on it. Don't wait.
All right, so the message from our ADA Government Affairs is don't wait, take action.
Absolutely.
Mobilize. Marko, how are you seeing the solvency of dental practices currently? How well do you think they're holding up economically?
Yeah, so I think we also collect data on collections, right? And I didn't show that, but that lags the patient volume, but collections are rebounding. They're somewhere around the 70% of pre-COVID levels. So I think for now, and again, depends where things go with additional financial relief and whether there is a potential, let's say, backwards movement in patient volume. But for now, by and large, there isn't a major solvency issue. And even the practices, as I mentioned, that have not opened, the majority of them don't intend to sell or go bankrupt or close. But we're going to be tracking this again. We're going to repeat some of that research we did. And just to piggyback on Mike's point, like the programs really help. Like in our data, about 40% of dentists receive PPP money. I mean, that's not trivial. And our research shows that did help them stay afloat and retain staff.
Yep.
We'll be doing similar research on the Provider Relief Fund. So for now, things are looking okay.
But it's still something that bears a lot of watching and taking action to do everything we can to close gaps is really critically important for practices.
And we'll be the first to know.
I want to move on to Jon, because Jon, you look at lots of different industries, and considering how you can put things in perspective, how do you think dentistry has weathered this storm overall? What points to the resilience and the ingenuity of dental practices and dentists and their staff and their hygienists working as a team? What's your perspective?
So thanks for the question. We certainly have been pleased to see that relative to the other sectors we look at, dentistry has actually fared incredibly well in terms of garnering the positive perceptions and the willingness of consumers and patients to come back. And I think as we look into the data a little bit more closely and think about it from other sectors, what really strikes me about it is the fact that people are really in a situation now where they're looking for not only things that they deem to be essential for themselves, but they're also looking to those situations where they have confidence and trust that something is not being done incorrectly. In some of the earlier waves of the research, we found people felt very confident that they were following the right protocols, but others weren't. And if you think about it, and this was expressed in the research, dentistry has been practicing these protocols and wearing PPE even before the pandemic. So when you're used to going in and having your hygienist wearing a face shield or masks or gloves, this was already there. And I think the other component of it that's really important is people tend to be more confident about re-engaging in those activities where the situation is more controllable and it's more finite. So the fact that they're in the examination room with a hygienist and a dentist and that's it is a lot more advantageous than sitting on an airplane with potentially 150 other people and they don't know what their situation is.
That's a good point. Marko, I'm going to circle back with you about dental teams after you get a chance to opine about what you think about the risk of transmission rates in the dental practice, since right now the public seems to perceive us as being a safe place to obtain necessary essential health care. What are we doing at the ADA in terms of establishing baseline metrics around what the actual incidence and prevalence of COVID in the dental team actually might look like? Do you want to comment?
Sure. So one of the things we did pretty early was to initiate a study. This is a collaboration with our science group and the Health Policy Institute to do a proper analysis and a scientific study on, okay, what is the incidence of COVID among dental team members? And we started with dentists and we're hopefully going to expand that now to hygienists. So that research is forthcoming. We don't have results to share yet. But I think it's important that we get kind of good numbers around this, right? And we have seen isolated cases. There have been reports of dental team members testing positive. We don't know the sources of those infections, so there hasn't been that kind of tracing done, at least to my knowledge. So stay tuned. We'll have a study coming out hopefully shortly. But again, being evidence-based, we thought this was really important that we get some numbers around this and see how big of an issue it is. And I think what John said is really important. I think that question about even if the public does find out about COVID cases in dental offices, I think it's important. John's public polling research suggests, look, with a little bit of assurances and again, telling people about the new protocols that are in place, we think that won't have a major kind of negative effect on people going to the dentist.
So I have an additional question that could be answered by Marko, Mike, or Nipa in terms of the dental team. We've heard some anecdotal reports that some dental team members are reluctant to come back. It's not consistent in every state, but it seems to be something that's happening in some states. Nipa, in terms of you bringing back your dental team and in terms of what you think is normal, the new normal. What are you thinking about in terms of assuring your dental team about safety, and what are you seeing among your patients in terms of coming back for more routine types of care?
So for me, staff retention was critical, right? And so I wanted to make sure that it was a collaborative process. The word of the year here is collaboration, I think. And so I had my staff come in and have a meeting very early in the game, actually socially distanced, but I wanted to know what would make them feel safe. And what I kept saying to them was, if one of you is unsafe, then all of us are unsafe. And so we need to make sure that there's a comfort level here that would allow you to be part of this team again. And that was really important. And I think that had I not had that conversation, there would have been a tremendous amount of reluctance. I have two staff members who are cancer survivors, two who are primary caretakers for parents in their 90s, and one with an 8-month-old child. So really there was quite a bit of reason for me to suspect that there would be hesitation. However, because they had buy-in, because they were allowed to provide me with input and feedback about the protocols that we were putting in place, I feel like we all walked in as a team, started providing care to the level of our comfort, and we kind of evolved together. So this really brought us all together. I know that it's not always the same for everybody, but if that's a possibility, sometimes it means putting a few more dollars, out to get some more protocols in place. But if the comfort level is there, I think the rest is what it is this year.
I'd like to ask Kirk to comment too, because he's got a thriving active practice. And I know he was focused on communicating with his team members early on. Kirk, what was your observation? What do you think the most important messages are to get your teams back together and being productive?
Thanks, Kathy. Yeah, good question. I agree with Nipa's comments. I mean, I think really what really launched us back into a good spot was having about 4 Zoom meetings before we even got back face-to-face in the office. We discussed everything, and I had a heart-to-heart with my staff members and asked them, are they really in this thing? Do they understand that, that we may be in a position where there's not 100% risk-free situation practicing dentistry? I mean, you had to lay it out there right at first. They all accepted that. Some of them that had some pushback, but everybody's back. So all my employees, I've got 6 hygienists and 6 assistants and 3 dentists. We're all back in the office at one time. All the administrative people are back. And I told Kathy earlier, I'd lost 1 assistant since then because in Virginia, all the schools our schools in this county are going to be shut down now until at least through the end of the year. And childcare is a huge issue. And I know a lot of you here in this meeting are going to have the same issue. So for me, it's not a matter of a safety thing. I think everybody's on board now. They feel safe. They've got the proper PPE. They're well prepared to come back and work in the office. It's more a matter now about their home life and how they're going to keep everything going at the home front. So that's where I see as a big stumbling block now for all of us as a profession, is how we're going to bring auxiliaries back, given the state of affairs with the school systems in this country.
Excellent point, because for the vast majority of dental team members are women, and many of them are women with children, young children. Just another question, and I'll include Dr. Gehani in this, since he's actively practicing endodontics, and Nipa is a general dentist, Kirk's a general dentist. What do you predict for the fall in terms of your appointment books? Are they going to be full, or what do you think?
My appointment books are quite full, and my wife's appointment book, she's an orthodontist. Patients are more than happy to come back, and the only difference is they love to sit down and talk. And we are not able to have a lengthy conversation with the patient. So they sometimes go home and wonder, what's wrong with the dentist who used to love to speak to me, and now we are like in and out.
Nipa, what's your observation? What do you think will happen in the late fall?
Very similar. I'm not sure what's going to happen this fall, but we'll be ready. We'll be prepared to handle, what comes our way. If it's another shutdown, then we know that it's what's in the best interest of the public, and we'll face it with smiles, and then we'll get back to work when the time is right. But I think, like Dr. Gehani just said, that's been the biggest difficulty. Actually, we hired a hygienist to cover some of the reschedules from the 3 months that we were closed. And she said, I don't feel connected. I'm not feeling that connection with the patients, because she can't take her mask off and have that human to human connection. So I think we're going to be seeing problems we never knew that we would have in the dental world. And I think that we've got some very innovative, solution-focused people at the ADA that are going to get us through the humps.
I know Dr. Norbo shared with me when he first reopened that the patients wanted to talk forever, and they just needed to wear a mask and get out of the office, right? Kirk, you want to comment? It's that same human connection that seems to be what we're all missing.
Yeah, and I had a patient come in yesterday, and we've all got stories, but this person had not been out of her house since this thing started. And I got to tell you, as much as I've talked about, we're all dentists, but we all should be some clinical psychologists and everything else involved, because I got to tell you, she was totally excited that I gave her a legitimate reason to leave her house. She was about ready to start hugging me. And I said, nope, got to stay away. You can't be hugging on me right now. But the bottom line is we have generated a high level of trust with our patients. I'm optimistic. I think that's the biggest message for this evening's this webinar, is that everybody keep their chins up. We're going to be okay. We're going to get through this thing. So I know we're all fighting the same battle. We're hurting with auxiliaries. The PPP loans and everything we've all been applying for, they're hit or miss. But thanks to Mike Graham and his group in DC, we've really weathered this thing, I think, fairly well. But that's my message for this evening for this group is stick with it. We're going to be okay. We're in this thing together. Stay unified, and we'll fight the fight and win the battle.
Certainly, the dental profession seems to be extremely resilient. And Marko, do you want to make a final comment? And then I want to zoom out a little bit.
Perfect. On this issue of the fall, and let's say a little bit beyond, I think there's a couple things really that tie together that we heard tonight, right? So if you look at Jon's public polling, right, it suggests that about 12% of the population who had gone to the dentist last year is not willing to return until there's a vaccine or some treatment protocol, right? So this suggests that at least in the short term, probably with the upside, the high end of where we can reach is going to be something around 88% of pre-COVID levels in terms of patient volume, if you believe those data. So what's just as important is our research is suggesting that the dental system now is close to full capacity. Remember, you have additional treatment protocols. We're spacing out patients. We're not at full staffing, right? So our last round of data suggested that the current patient volume is actually close to what's maximum in the short term. So I'm not sure it's even feasible to treat 100% of pre-COVID patient volumes as an analyst. Now, as dentists may think differently, right, in their individual practices. But that's why I'm thinking, okay, we're close to 85, 88% is probably the short-term max in terms of percent of pre-COVID volumes in terms of patients. And that's probably the max of what the system can absorb now, right? So I think that's important to put into context.
So we have about 5-6 minutes left, and I'd like to zoom out for a bit and ask you each to think about what was one profound lesson you learned during all of this. I think many of you have mentioned things here and there, but I'm going to pick on Nipa first. What's the most important lasting lesson you've learned through all of this, Nipa?
That it passes. Whatever it is will pass, and that collaboration is key, and to lean on the ADA. The number of resources that the ADA has provided that have helped me feel unstuck in the last 3 months. I can't even begin to tell you the gratitude that I feel knowing that I have you all in my corner.
Thanks, Nipa. Jon, what's your lasting impression here?
This has obviously been such an eye-opening and a real privilege to be able to support the ADA and to work with you. And it's funny and corny as it sounds, I've gained a greater appreciation for the profession. I'm actually having a cleaning next Friday, and I'm excited about it. Woo-hoo. Because, it gave me a greater perspective of where the profession sits relative to so many other sectors that we look at. And I thought Kirk's comment was really compelling about just that human-facing component and trust that a dentist can provide. I think that's something that really has been illustrated through a lot of the data that we've collected, particularly as we compare it to certain other activities and things that people need to do.
Now I'm going to let Mike go next, but remember, one of your bosses needs to be last here. So Dr. Norbo still has his 2 cents. Mike, what's the most important lesson you've taken away from all of this in terms of working with policy wonks? And do mention why we needed a definition of essential. Because I think we've always assumed dentistry is essential. That's why we all went to dental school. But from your perspective, why did we need to put that in black and white?
Let me say that what I think is very clear to me is that when our dentists engage in the political process, our voices are heard and our legislators respond. And when you have 600,000 dentists sending emails to Capitol Hill, they get the message. And certainly I got a phone call Monday morning at 8 o'clock in the morning from the deputy administrator at SBA saying, please turn off your grassroots. We got your message. Now, I think we need to give that same message to our legislators on Capitol Hill and in state legislatures when it comes to essential oral health care. But we need the dentist to respond. So everybody on this call, this webinar needs to respond, but you need to get your colleagues to do the same. So if we do that, I think we'll be good.
Kirk, last few thoughts about what you've learned and what are the important messages for everyone on this webinar. By the way, we've had over 700 people listening in, so fabulous.
Well, as I mentioned before, I'm optimistic about the future, where we're going with this. I would say that along John's lines of saying something maybe sounds a little corny, but you know, being as close as I've been to the ADA and leadership and everything for the last 4 years almost, I thought we were performing at a high level then, and I didn't know we had a higher gear than what we had. Well, we did. I mean, it is truly amazing to see the people that have stepped up in leadership positions and the staff at the ADA that have done what they've done for you. That it's been exceptional. Like, I can't even explain the amount of time and effort that's gone into some of the stuff that we provided and the ADA's provided. But I just think we as a profession are known for our ability to cope and to deal with adversity. I mean, you look at, the old dentist I took over for in Falls Church, they were supposed to have a vaccine come out in 1935 when he graduated from Georgetown. Well, guess what? Where'd that vaccine go? It never came out for caries. It was a vaccine for caries. So the sky is continually falling on us, but this is real. I mean, we are up against a real battle right here, but there's no doubt in my mind we're going to win. And it's just a matter of sticking with it and keeping our wits about us and paying attention to the right protocol and doing the right things. That's my message for this evening.
Well, you know, Chad, I'm going to let you close because this has been one heck of a year for you to be president of the American Dental Association. I think in hindsight, if you could have picked another year, you might have chosen 21, 22, 17, 18, but certainly 20 has been a challenge. So what's your big takeaway?
If I had to pick up the year again, I would pick 2020. What an honor to be the president of the ADA during the time when ADA has proven to be the trusted source of dentistry globally, not just in the United States, but globally. And we have lived by proving it by example, not by just saying it ourselves. So we all should be very proud of our own beloved American Dental Association. And with this, good night to all of you for attending tonight's webinar. Thank you.
Thank you all, and thank you for the attendees. We're grateful for your participation, and thank you to the panelists. You were all fabulous. Marko, thank you to your team for organizing this, and best wishes for a good week, and stay well, stay healthy, and stay hopeful.
Thank you.
Good night.
Thank you.
Good night. Good night, everyone.